Hello everyone, today we are going to talk about hallux valgus. Is your big toe leaning more and more outwards, crowning the smaller toes to your foot? Do your foot hurt after a long walk or often even at the start of the day? Is this pain restricting your flexibility and mobility in your daily activities? Then just like so many the other, mainly female, patients of our foot and ankle department, you are suffering from Hallux valgus. Bunions can form one or both feet. Surely you have many questions regarding this foot deformity, but everything will be clear after watching this video. Our role today is to answer most of your questions regarding Hallux valgus. Today we have Dr. Kim, who is a leading doctor at Yonsei Sarang Hospital. He is going to discuss with us everything about Hallux valgus from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases.
Hello, Dr. Kim. Can you please introduce yourself?
Hello, my name is Yonsei Kim, and I'm in charge of the Foot and Ankle Joints Department at Yonsei Sarang Hospital.
Dr. Kim, what is Hallux valgus?
Hallux valgus is a disease in which the big toe is bent toward the second toe, and the inner part of the foot protrudes as a result.
So what factors contribute to the appearance of Hallux valgus?
The most common cause is shoes, and it is known that Hallux valgus is more common in women, and in particular up to 30% of women over 50 years old. Shoes are so important. Women's shoes run narrower than men's, and there are many shoes that close up to the feet like this, so it's one of the biggest causes of Hallux valgus.
Does heredity have any influence in this condition?
Yes, it is known to be hereditary. It is known that 50% to 80% of cases with a family history show Hallux valgus, in particular in the case of Hallux valgus that appears in adolescence. There's often a family history.
How about the symptoms?
Since Hallux valgus protrudes from the inner part of the foot, if it comes into contact with the shoe and the area is stimulated, inflammation may occur. Normally, the big toe must bear more than 60% of the body weight. But as the big toe is bent, it results in stepping more towards the second or third toe. In particular, calluses may form on the front sole of the feet, and it hurts a lot when walking.
Can you tell us more about the different stages of this condition?
Hallux valgus is a disease in which the big toe is curved toward the second toe, so it is divided into early, middle, and late stages depending on how much the big toe is bent. And the treatment method is slightly different accordingly.
So in this case, what kind of medical examinations can be done to diagnose Hallux valgus?
To diagnose Hallux valgus, it is basically necessary to measure the angle of the bone through the X-ray examination. If necessary, tests such as MRI are also performed to see if there are any abnormalities in other structures in the vicinity, or if there is also cartilage or ligament damage.
So after diagnosis, what kind of treatments are available for patients?
In the early stages when the big toe is not very curved, conservative treatments such as medication or ice packs can be used to control inflammation. However, if the bone is bent, only surgical treatment can ultimately correct it. The purpose is to get the original foot shape.
All right. So we just talked about surgery. In the case of surgery, are there any contraindications that a patient could expect?
Hallux valgus is a disease in which the big toe is curved. As the Hallux valgus progresses further, arthritis may develop in this area of the big toe. So in the case of end-stage Hallux valgus, where arthritis has already progressed, it is not necessary to undergo surgery to correct the bone, but to treat the arthritis again. Also, although it is not common, there are cases of instability in this dorsal joint. In the case of instability on the dorsum of the foot, if you have Hallux valgus operation, the results of the operation are not very good because the foot is unstable. In such cases, treatment other than surgical treatment is required.
Okay. So after surgery, of course, there will be rehabilitation. So what kind of rehabilitation can be done after surgery?
The surgical method is to correct the bones and fix them with pins or screws so that the corrected bones can attach properly. After surgery, you should not step toward the big bone for about 6 weeks. And after 6 weeks, take an x-ray, and if there is evidence of bone fusion to some extent, then you can start to step toward the big toe. Since the big toe has not been used, after 6 weeks, rehabilitation exercise to raise and lower the joint is needed.
So you said a while ago that female are more prone to hallux valgus. What kind of prevention can be done in the case of female and also for male?
Of course, as I said before, one of the biggest causes of hallux valgus is shoes. So if you have hallux valgus, it's better to wear shoes that run wide and avoid high-heeled shoes that put your weight in the front of your feet. Also, hallux valgus may occur more in the case of flat feet, where the arch of the foot collapses. So, wearing shoes that match the arch will help prevent hallux valgus.
네, 알겠습니다. Thank you, Dr. Kim, for giving us of your time.
Thank you.
감사합니다.
Today we learned many things about this common disease and the doctor explained in details everything related to this common foot deformity. Thank you for joining us once again at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.